Jardogs is really focused on really patient access solutions. So, our story really started with looking at automating the patient check-in process, and we wanted to really take all of the inefficiencies out of that process, make it electronic, kind of streamline it like the airports did. With our product, we decided we would build a patient check-in kiosk and pretty well handle all aspects of the check-in except for those complex forms. And that's what we brought to market. That was our first product. And we were trying to figure out how we handle complex forms to close the loop and truly automate the check-in process. We decided the best place would be at home. So how could we tender those forms for the patients to fill out in the privacy of their own home? And we started looking at different patient portals that were out there. And to be honest, this was 2-3 years ago, there really wasn't a vendor out there that was positioned well to be able to take that form, fill it full of discrete data, and bring it back down to our kiosk and the physician. Ultimately, we decided that we were better off building it on our own. So we came out with our product line, Follow My Health, which is the product that we're delivering today. The other aspect of that product is that when we were looking at communities that had multiple EMR systems or hospitals and clinics within that community, all were looking at building their own or connecting their own portal. And so we stepped back and looked at it through a physician or a patient lens. And from the patient perspective, that means that I'm going to have to manage 3, 4, 5 portals within my community to take care of my health. And in all honesty, we sat back and said, we're not going to do that. As a patient, I may manage my primary care portal, but I'm not going to deal with the hospital portals. I'm not going to manage all those logins. I'm just not going to do it. So what we decided to do is to build a solution where we could take the power of a personal health record, but the connectivity of a patient portal, and bring that together. So the patient owns the data and allows that data to flow to their physicians, as opposed to creating more like an HIE where the data is just flowing. So we put the patient right in the middle. They own the data, they control the data, but they have the connectivity that a tethered portal has. There's a lot of consolidation going on in the marketplace, and with that consolidation comes multiple systems. And because so much consolidation is occurring, plus the requirements of meaningful use, that our customers are really struggling with, how do I integrate those systems? How do I present a single view to my patient, even though I have this complex kind of mush underneath me? And where the Jardogs solution comes into play is that our solution has the ability to pull data from all the different disparate systems, convert it to a common nomenclature, and then present that to the patient. We're looking at how can a physician engage a patient to be more involved in their health care, as well as how can I monitor and manage that patient at home. And because of the Follow My Health infrastructure, we have that conduit already in place from the patient to the EMR. So, we're going to look at leveraging that heavily in the very near future with some at-home product offerings for patients to be managed. As we shift from fee-for-service to fee-for-value, we're going to have to figure out ways to make it very easy to engage patients, whether they're at home, they're in our clinic, or in our hospital, and be able to provide services that add value to them.